Great. Which technique I'm going... Now this is the first demonstration on the neck and shoulder. Which technique I'm going to start from yesterday? Remember, what was the first one? Before? The holds, right? So remember, you need to prepare yourself. Even you can do like a nice stretch or finding a nice balance within yourself. And then you can start by putting your hands here. And again, just listen really. I don't put a lot of pressure. I put quite light pressure just to make a connection. I can change it and do also one hand on the head as an energetic relaxation. You see that my stance, my legs are quite distant from one another because this is the way I find comfortable. If I will, look what happened to my spine if I come up, because I'm too tall, and then I give way, rather than just open it, and then I feel, even bending the legs a little bit, it feels quite springy, quite comfortable, and yeah, you ask for active life and active profession, so this is it, you know. You can do it even on the neck. You can do it even around the sacrum or the bone in between the hips. Really listen and see whatever comes. Can you feel the breath here even? Maybe. You can come even to here and just really nicely just sit. And even on the neck and shoulder, do try to feel the rhythm of breath. So now you're ready. Before I start the Effleurage, I would like to show you more, not exactly technique, but standing positions, treating the neck. So we can make sense to where do you stand. So the first stand, you can treat the neck and shoulder coming from above, around the head. You can do it both here, maybe one hand. You can come to do it quite low, you know, really nice stretch for yourself as well. Yeah? So you do many techniques from coming from above the head. Later on in the course, we do even forearm technique coming from here. You can do nice mobilization, even pushing, but not now, okay? The second position is that you come across the shoulder on the other side. And you can do many techniques from here, like that. You can do nice stretch. You can do working on the neck from here. I really like, if you can come even, you can come to more the top part of the table, because what I would like to show you is really this small bay that I really like working from. So you see that I'm not here, but my front leg, my upper leg is right in this bay. Now why is it so comfortable? Because I'm quite close to. If I will be here, do you see the difference in my body? Yeah. I'm not comfortable. I can do that, but there is a long distance between me and the body part that I use to massage. It's not comfortable. And look what happened to my spine. If I'm here, it's very comfortable. Yeah? So I'll use a lot this space as much as possible to come fairly close and use it wisely. Yeah? So the second position is across the spine, across the opposite side, and the last one is if I'm coming from that position. And I can use certain technique from here, okay? So when it comes before the technique itself, think about the positions, where where do you position yourself? And a lot of the time you will spend yourself thinking about, how can I do it better? How can I, yes, I feel the soreness shoulder. Should I do it from here? Or maybe I should do it this way? Or maybe I should come from here and do it this way? Or maybe I should come and do it this way? There are a lot of options. And what I would like you for every area to know about 6 to 10 different techniques. So every time you in the treatment, you feel how your body, you scan your body and feel how tired you are. Maybe your elbow's tired, maybe your wrist tired, maybe you can do it. So you have options to do and change all the time. You can't only work with your thumbs, but you do some with your thumbs, okay? Let's start, yeah? We did the hold, taking that. Can I undo the bra?
Yeah.
Yep.
Baby trap.
Thank you. Good. And same amount of oil. Now, when I massage the back, I'll start with the back. You see that the back is relatively square, so it's not a problem to do the effleurage. But when I come to do the neck and shoulder, do you see how many curves are there? So I need to follow them. And what we find out that there are 2 types of effleurage that would be nice to work with. And for that we need to change. I need to be there and you're moving again below. Yeah? So the first effleurage is it's called the diamond effleurage. It has a more of a diamond shape. So it works like that. You're coming down, then you're bringing fingers to fingers, and then you drop your knees, and then you straight your knees. The rest happen kind of by itself. So down, drop your knees, and bringing it down. So again, down. You can't go all the way, because you see what happened to my back. Yeah? So you can be realistic to say, okay, up to here, down to here, and then again, up, fingers to fingers, drop your knees, and then wrap it really from, almost from underneath, almost like lifting it, yeah, but not lifting it really, and then doing the rest. So from here, almost lifting it, and see what happened. From here, all my fingers and palm is in contact. But when I go up, it changed to fingers. And then I go all the way to the scalp. This area is very, very important because a lot of tension headache would arise from tension from the neck. Yeah? So, do you want to maybe do it together with me? Yeah? So, down, up, fingers to fingers, and then the reason my hand goes to the side is because I drop my knees. And then change, knees straighting, and then going up. So, the reason there is movement is the knees actually, okay? So quickly it goes like that. It does look easy. It will take you a good few months to really find comfortable with, yeah? Good. Right. So this is the first one. The second one is a little bit easier. It's the side-to-side effleurage. So what do I do? Look, I can stay here and just do that. But what happened is that I use a lot of my arm. And actually I kind of lose a bit momentum, and if I need to do more deeper, it's getting to be hard. So I use my body as a weight. From here, I move. Now I need to go back, so my hand automatically end up here. You can do one side. Yeah, and again. So your body, your head even, almost like touching the floor to the side. You're doing exercise. Yeah, you are. You're really just making your body feel very refreshing by doing the exercise this way. Yeah? And I bet the client could feel the difference if I use my body or not, okay? So let's try. Let's try between this one and this one. Do you feel the difference? Yeah. When you use your body, it's a fuller touch. It's a real fuller touch, okay? So you can do it one at a time. And again, just see the difference between a full touch, because I have more space here. Still the palm is in contact. Now I start losing the contact with the palm, only the fingers. Because I'm moving from here to here, I go all the way and spend a little bit more time on the attachment of the muscle to the skull. I would like you to take 2 fingers and go to the neck and feel the attachment of the muscle to the skull just by nodding your head up and down. Do you feel this area? Yeah? Now look a little bit up and massage this area. And feel how nice and sore it is. Yeah? So that's the attachment of the neck muscles to the skull. Okay, so we did the Effleurage, right? Now we need to do the Petrissage. So I will start with the Petrissage. Why don't we change here? I'll start with the Petrissage across the shoulder. Opposite side. Okay? So opposite side. First of all, there is the link between the back and the neck and shoulder. So you can use the same finger kneading we did last time. Remember yesterday? Reinforced finger kneading. Working on the back muscles, and then from there going to the shoulder muscle. You know which muscle is here? Trapezius, yes. It's one of the most common muscles to massage. So you can do that by coming here. So you're fairly close. And you're just looking for tenderness or tight muscle. And what I would like to do is to show you that I still bounce my body. You see? All the time. I never really fully stop. Even if it's a small movement, it's like I do that. Nothing happened. Well, something happened in the fingers, but a lot of the force coming from my weight moving, what we did yesterday. Yeah. Even to exaggerate it, nice stretch. So I lean onto there. Yeah? So I try to move the muscle as much as possible. I can then move it between my fingers and my thumbs. Yeah? Even 2 hands or coming closer together and do more like alternating hands. So really trying to squeeze it. And every time you squeeze, what happened to the blood circulation? Is the blood comes in or goes out when I squeeze it? Goes out, and then you release, fresh blood comes. Yeah? Okay, so this is about this position. And then we did only the shoulder. We need to go to do the neck. The neck, look, in this area I can go and press down. How do you feel if I press down here? Not very good, right? Why?
Because
yeah, I'm going to maybe press on the windpipe, entrance to the breathing. So we don't press down on the neck. We just take it to the side and try as much as possible to lift it. Yes, you can do that, or you can do a little bit side to side, very gentle side to side. So it's a little bit of mobilization, a little bit of just moving it while you're massaging it.
So are you grabbing this?
As much, not so much, I just put contact and pressing the two muscles, one from the right, one from the left. So if this is the neck muscles, these are the two muscles, I just press them and then try to move them together. So I kind of squeeze them together. Yeah? So they're quite backward, yeah, and quite smaller than these muscles. Okay. Coming from above, I can do one of the few. Maybe you can go down, back there. You can do one of the few. You can nicely change your position and do that. Or you can do the same thing with massaging with the base of your wrist. You can do the same with your knee down on the floor. Okay. You can do that with knuckles. Now, do you see what happened to my wrist here? Is it ideal, do you think?
No.
Why? Because it's bent.
Then.
Yeah. And for those of you with flexible joint, it might be too much. So you're trying to keep in a neutral position your wrist. Not bend this way, not this way, not that way. In a neutral position, it means that it continues with the forearms. So instead of doing that, how about just taking the knuckles and just really nicely massaging this way? Might be a lot easier, yeah? You don't put your thumbs in, the thumbs slightly out, and one at a time even. Or even you go this way and then you go a little bit in. But you see what happened? To go in, I have to come closer. Do you see that? So you need to move your body so your wrist would be neutral, in a neutral position. Okay. You can come from here really nicely, massage just the upper neck muscles, even, a little bit on the scalp. We will learn the scalp massage on weekend 5, I think, and for the last one, you can come from this side and just do nice squeeze, the same thing, but a lot of body movement, yeah? Stretching this way.
So you use your fingers.
It's the reinforced fingers, yeah? But I don't move the fingers, I move more my body. And try not to lift your wrist lying comfortable, so you're kind of in a cupping position, yeah? And then your body moves with it all the time. And then you do a little bit of movement there on your hands. Yeah. Maybe one more advanced technique that is really nice to do, and that is using more of your momentum. So you're coming from this point, and you're using a loose fist into here, and then to keep the wrist straight, you're actually moving downward while you're moving upward. Okay? So again, from here, try to keep the wrist really in a neutral position. Like that, and then you go up. Now you have to be careful not to really push their head lightly. So do it lightly, okay? Do it lightly. Part of your course is building sensitivity to how much you can do for each client, okay? But if you feel comfortable, then start doing it as a movement. You can do it as an effleurage even, really nice. this way. And then from here, really stretch. Even stretch one around the hip and one there. It's funny, I do it and I feel my abdominal muscles kind of working. Yeah. So it's a full body from your behalf to do that. And keep your hands soft, really. I know it's plenty, but we'll go and remind you how to do that, okay? Cool.